Raise your hand if you have children. I'm sure to this day you still worry about the safety of those children, but when they are infants, I'm sure you worry even more. As a new aunt, I am very interested in learning all that I can about keeping babies safe. Sudden infant death syndrome is a real and threatening issue that people everywhere need to be informed on in order to help prevent it. Today I'm going to talk to you about the different risks that are associated with sudden infant death syndrome, as well as ways to prevent it, including the Back to Sleep campaign. While it is impossible to tell which children will be affected by SIDS, there are still some indications. There are many risks that go along with sudden infant death syndrome. One form of risk categories for sudden infant death syndrome would be intrinsic risks. According to Tara Ramirez and Michael Malloy in a 2013 article titled Sudden Infant Death Syndrome, Are We Any Closer to Identifying Which Infants Will Be Affected? Some examples of intrinsic risk factors would be male gender, low birth weight, prematurity, and an infant being small for his or her gestational age. These risks are uncontrollable. For some reason, having a baby boy born prematurely is going to make him much more susceptible to dying from SIDS than having a girl born on time. While there is nothing we can do about these risks, there are some risks that we can control. Another form of risk category would be extrinsic risks. According to Tara Ramirez and Michael Malloy in their same 2013 article titled Sudden Infant Death Syndrome, Are We Any Closer to Identifying Which Infants Will Be Affected? Prenatal smoking and alcohol consumption can cause problems with the child's sleep pattern in the first few days of life. This is important because in this time they're going to be the most vulnerable to die from SIDS because they are newborns and they are sleeping. Mothers need to stay away from these toxins at all costs. And while it's important to take these precautions before the child is born, they must continue after the child is born as well. There are many preventative decisions that parents can make to stop SIDS from happening. One form of this would be providing nutrition to your child through breastfeeding. Authors Fern Hauk, John Thompson, Kawai Tanabe, Rachel Moon, and Mechtil Bieneman, in their 2011 article titled Breastfeeding and Reduced Risks of Sudden Infant Death Syndrome, a meta-analysis, state that breastfeeding confers immunologic advantages over formula feeding by providing immunoglobulins and cytokines that may protect infants during the vulnerable period for SIDS. So when a mother breastfeeds, she knows what she's feeding her child, and she also knows that she's offering even that much more protection for her child against SIDS. When the article talked about immunoglobulins, which are also called antibodies, they work with our immune system to help protect our bodies. A healthy baby will have a much harder time dying from SIDS. Equally as important as baby's nutrients would be its environment as it sleeps. Babies have almost no control of what goes on around them, and this is especially true when they are asleep. In a 2011 article titled Sudden Infant Death Syndrome, Are We Any Closer to Identifying Which Infants Will Be Affected? Tara Ramirez and Michael Malloy state, a firm sleep surface is recommended and should be devoid of soft bedding to prevent SIDS and suffocation. So when a parent can make sure that there are no toys or blankets in their child's bed or crib, they are offering just one more barrier between their baby and SIDS. And as I mentioned sleeping, I would now like to talk to you about this Back to Sleep campaign. The Back to Sleep campaign is a great preventative action against SIDS. As the title says, this campaign calls for babies to be placed on their back when they go to sleep. Felicia Trachtenberg, Elizabeth Howes, Hannah Kinney, Christina Stanley, and Henry Krause, in their 2011 article titled Risk Factor Changes for Sudden Infant Death Syndrome After Initiation of Back to Sleep campaign, state that the major advance in research into sudden infant death syndrome is the recognition that the prone sleep position increases risk twofold or more. When they talk about the prone position, they are referring to placing a baby on its stomach to sleep, which is very unsafe. The fact that there is a whole campaign based solely on how you should place your baby to sleep really goes to show how important this issue is. And thanks to this campaign, there have been changes in how parents place their babies to sleep. Because of these changes, there has been a huge decrease in the number of deaths of babies that have died from SIDS. In this graph from the American SIDS Institute at SIDS.org, you can see just how successful the campaign has been in stopping SIDS. Since its start in 1994, the rate of deaths from sudden infant death syndrome has gone down greatly and has decreased by more than 50% in some years. As the evidence from this campaign shows, it is very important to be informed on this issue. So today I talked to you about the risks that go along with sudden infant death syndrome, as well as different ways to prevent it, including the Back to Sleep campaign. Sudden infant death syndrome is a real and threatening issue, and we need to be informed on it in order to help prevent it. So today I ask you to continue to be informed and to leave this room remembering what I told you and pass it on to those around you so that we can save babies everywhere.